Hi everyone, I am Dr. Arul Prakash and practicing gastroenterologist from Chennai. So inflammatory bowel disease is a raising concern among the common population. So many people are coming across and getting diagnosed as inflammatory bowel disease. I'll just take 2 minutes to make you understand what it is. This is the disease of the intestine, spontaneously happens, which involves small intestine and large intestines as well. So any age group can be involved, but predominantly an younger age or an older age is involved. So what are the symptoms you can have? You can have chronic, that is long-standing loose stools, abdomen pain on and off, blood in stools, and there may be fistulas and fissures of the anal area. So many of them just get treatment anywhere in the periphery. When it persists for more than 6 months, they come to the gastroenterologist. So we have a protocol on diagnosing these patients. We do have blood investigations, stool samples, and imaging like an MRI or CT, and finally endoscopy, where you go into the intestine, take biopsies from multiple sites like large intestine and small intestine. And when we read that under microscopy, they have a classical signs of inflammation. Then we label this as inflammatory bowel disease. Do you have a treatment options? Yes. Nowadays, they have good medicines which can keep the disease under control and in the longer run to keep it quiet and have a good quality of life. So there are two entities in inflammatory bowel disease. One is called ulcerative colitis, where it involves only the large intestine part. The other entity is Crohn's disease, where it can involve anywhere from the mouth to the anal area. It can involve stomach, small intestine, large intestine, and fistulas and fissures. So we have to understand that treatment is a little bit different in these two entities, though they mimic the origination and the immunity which causes this problem is the same, but the course of illness and the treatment differs a little. So we have to differentiate between these two. There are good tablets which are available, and there are newer injections to keep this under control. So you have to consult a gastroenterologist for this. So what all can be done to keep it under control or avoid such inflammatory bowel disease is having a good healthy diet, avoiding processed foods, and there are certain food which can trigger this inflammation. So when you have a suspicion of having this inflammatory bowel disease, you have to consult a gastroenterologist. Then they will be suggesting you this anti-inflammatory diet. And better is to avoid all these processed foods. Processed food means that the food which goes through a industry or a company, a lot of changes which happen. Unlike our rice or whatever unprocessed foods which we get, that is safer.